Peace, everyone. Can you see me? It's a little dark. All right, but I'm a flow anyway. All right, everyone. Welcome back. Haven't seen you all in a bit. It's your brother Bashara, and today I'm bringing you your medical doctor recommends acupuncture. Who would have known? A lot of folks still think that acupuncture is something that it's just alternative medicine out of the medical field. Hey, Doriel, old school folks. There are a few things that you can do to help yourself get rid of pain. The first thing that you can do is an Epsom salt bath. Epsom salt is magnesium sulfate. And, Epsom salt baths, folks have been taking them for hundreds, probably like thousands of years. It's a naturally occurring salt or that comes out of the earth. It's not like table salt. It's actually magnesium sulfate. One of the things that Epsom salt does is to decrease inflammation in the joints. So when you take a nice Epsom salt bath, it really helps to relax the joints and decrease inflammation and swelling. You think about swelling. Sorry, it's so dark. When you think about swelling, it's like rush hour traffic. A rush hour on the train where everybody's just packed in there on the train, and it's just tight and it's uncomfortable. And so with the Epsom salt, it helps to relieve some of that pressure. Like when you get to Union Square, 34th Street, and a whole bunch of people get off the train. There's still people on the train, but it's a lot more relaxed. And so that's one of the things Epsom salt baths do. Again, another thing it does is just relaxes the body in general, and it also flushes toxins out of the body. So Epsom salt bath is like a real good, just natural detox. You can get a box of Epsom salt from any pharmacy. Doesn't cost more than like $1 or $2. As a professional, I enjoy, helping folks in the office, but I really enjoy helping folks with, things that they can do at home. Like one of my goals in my practice is to say have a healer in every household. So Epsom salt is something that you may find in the cupboard, and it may just be there dry and all stuck together. But scoop a cup or two out of that into your bath water. That's pretty much what's recommended. About a cup or two into a hot bath, and just soak. Was it what was the thing? Was it oil Volay? Take me away or whatever it was. Another thing that you can do to get rid of pain is to simply drink water. Like a lot of us walk around here chronically dehydrated, where we just don't drink enough water. And with drinking water, our whole bodies are alive from our head to our toes internally. So we have millions and millions of cells in our body. And every single one of our cells are giving off liquid and solid waste. Just like you urinate and defecate, all of your cells are giving off liquid and solid waste. And that goes into what's called like the extracellular fluid, and then your lymph system and other systems in the body take that and take it to your intestines, where you let it out in terms of like a bowel movement, or you urinate it out, or when we sweat. And so we want to drink a lot of water so that we don't have the same stagnant water in our body, and our body is like bathing in its own waste. We don't want to we don't want to do that. So we constantly want to be drinking water. Water is also the ultimate solution. Most things dissolve in water, and our bodies are over 70% water. So we want to make sure that we're drinking enough water. What's recommended is about like 2 to 3 liters of water a day, or some folks may even say half of your body weight in ounces. So if you weigh 180 pounds, you want to be drinking at least 90 ounces of water. So that's about 2 to 3 quarts or 2 to 3 liters, a little bit less than that. Please, Brother Justice. Just give you a quick testimonial. A patient in my private practice, she gets like terrible headaches all the time. And where she isn't able to come in as frequently as I would like her to, or as she can. So one of the things I told her, I said, you probably need to drink more water. I said, you told her you need to drink about 2 or 3 liters of water a day. And so when I saw her over the weekend for a follow-up treatment and asked her how her headaches were, and I hadn't seen her in about 2 to 3 weeks, she said that her headaches were gone. You know, she was having like painful headaches every day. And she said that her headaches were gone just from drinking more water. She followed, you know, my recommendations and just drank 2 to 3 quarts of water a day. Another patient of mine and a friend of mine, the same thing. He had some bad knee pain, and he wasn't able to get to the office as frequently as we would both like him to. And he told me his knees were doing a lot better just from drinking more water. So if you're walking around with sore knees, sore shoulder, neck pain, back pain, it may be due to, you know, some structural stuff and, you know, different things going on in the body. But just drinking enough water, your body will give your body more of a chance to, you know, to fight it and to feel better. And lastly, the title of this Facebook Live, or this live, is, you know, your doctor recommends acupuncture. So one of the things that's going on now, actually currently I just started working on my doctorate in acupuncture and East Asian medicine. And for one of my classes, dealing with U.S. healthcare system, we've been really looking at the role that acupuncture plays in the healthcare system, and looking at a lot of evidence-based medicine showing the scientific research that's being done with acupuncture currently. And so the American College of Physicians has actually just released a big paper recently where they've recommended acupuncture, among some other things, but acupuncture as a non-pharmacologic and non-surgical approach to pain, to back pain specifically. So your doctors now are saying before you take drugs, you know, pain drugs, and before you're recommended to have surgery, you should try acupuncture. Also, the Joint Commission dealing with this opioid crisis that you're hearing about now is also recommending acupuncture as a non-pharmacologic, non-pharmaceutical, and basically a non-pharmaceutical approach to dealing with opioids. You know, one of the things with like heroin addiction that has been recommended over the years has been like methadone. But methadone is pretty much just a pharmaceutical form of heroin, so folks are still over here nodding off, but instead of shooting up, they're taking pills. And then with the Oxytoxin, the Oxycontins pills, we know that a lot of folks out here are using those not just for pain, but to get high, and they're getting heavily addicted to it. For many years, many decades actually, acupuncture in the form of auricular acupuncture, which is acupuncture in the ears, has been used in Lincoln Recovery Hospital and different hospitals around. Actually, my wife, Dr. Danette Beans, a doctor of acupuncture, and she actually is the supervisor for the acupuncture detox program at Downstate Hospital, where we actually use acupuncture with with Narcotics Anonymous and other counseling to help folks break heavy addiction to drugs, heroin, crack, cocaine, all sorts of things, using acupuncture in the ears. I've helped a lot of folks to stop smoking and volunteered my time over the years in some of these programs doing the ear acupuncture. So just want to let you know what's going on out here, and hopefully you can use some of these recommendations around the Epsom salt bath to help relieve yourself of pain naturally, around drinking water, and also knowing that, you know, acupuncture is becoming mainstream, and you will most likely start to see more departments for integrative medicine popping up in your local hospitals, where they're going to be doing acupuncture massage right in the hospitals, as opposed to something that you have to go to a private practice. Many insurance companies accept acupuncture. The VA, the Veterans Administration, they actually pay for acupuncture for the veterans, and is big in the military, the U.S. military. So it's becoming accepted a lot in the mainstream. That's pretty much it. I'm Bashar Wilson. I'm a sports medicine, acupuncture, and pain relief specialist. I specialize in helping folks like you to get rid of pain. This week, actually next week, my schedule is pretty booked for this week, but next week I've opened up 3 spots for freedom from back pain free evaluation. So to take advantage of that, you can go and call my answering service at 888-375-5444, 888-375-5444, or you can go right to my website, www.newyorksportsacupuncture.com, and you can actually book yourself in. And if you have more questions, you can just inbox me. During this free evaluation, we will discover the root cause of any pain that you might have, uncover any blockages that are stopping you from healing, and create an action plan to get you out of pain once and for all. You'll leave feeling renewed, rejuvenated, and ready to get rid of that pain once and for all. So I hope to see you all soon, and I'll see you on Facebook Live soon. Thanks a lot for your time, and stay healthy. All right, folks. Peace.